Hi, I'm Josh Richards. I'm a shoulder, elbow, and hand surgeon in Oakland, California. Today I'm going to talk to you about what to expect after distal humerus fractures. So the distal humerus is the elbow side of the arm bone or humerus bone, shoulder being up here. The distal humerus is just down here. Often this fracture can go into the joint. So if the joint is broken, where these condyles are fractured off from one another, that is something that's going to need to be fixed. So I'm talking about in adults today. There's another video for kids. So if you have a distal humerus fracture, typically you're going to need plates put on that. That sounds awful, but the idea is to stabilize that distal humerus fracture so that you can get your elbow moving. The plates, sometimes if it's really just two main pieces and not three or four, one plate can be okay. Basically, the cut is usually more on the back side of your arm, coming down over the elbow, and then the plate is placed more on the back side of the humerus bone or on the very outside. So depending on the type of fracture, the plate might be placed more on the thumb side of the humerus or more on the pinky side. It depends. Sometimes you need a plate on both sides. It's really up to the surgeon. The idea there is you need it stabilized so you can get it moving. The biggest problem with elbow fractures is stiffness. So if you get your fracture stabilized, then you can get it moving quickly, and hopefully you do not end up losing motion. However, the average person does lose motion. The motion that's typically lost is your ability to straighten your arm all the way. So in distal humerus fractures, the average person loses about 10, even 15 degrees of their ability to straighten their arm all the way. Now that usually doesn't cause any functional problem. It just looks a little funny. So when you go to straighten one arm versus the other, it doesn't go either way. But even a really high performance athlete, depending on the sport, it may not affect you at all. For the average person who likes to lift weights or play rec sports and things, it really very unlikely to cause you any problems. High performance gymnast, okay, that's going to be a problem. As far as strength goes after distal humerus fractures, the average person does lose some strength, about 25%. So you can expect not to be able to straighten your arm all the way completely, albeit that really shouldn't affect you, and you can expect some loss of strength. However, rarely does that affect people in any significant way, but it could. So it's a pretty significant injury. If you have a distal humerus fracture, if it's displaced at all, you're probably going to need surgery. In that scenario, you may not get your arm all the way straight, and you're probably going to lose some strength. However, overall, most people do really well. They get back to doing all the things they used to do. Maybe if they were like a bodybuilder, well, it doesn't feel quite as good, but doesn't mean you can't go back to it. But those are the biggest problems, some loss of strength and a little loss of motion. Occasionally, there's some nerve issues involved. The ulnar nerve being the most common. That's the funny bone nerve that comes along the inside of your elbow. It gives you some numbness and tingling in your pinky. Some people have that before surgery and then sometimes after. Typically during surgery, we have to move that nerve out of our way, or sometimes certain types of fractures we don't have to move it out of our way. So that can also be a bit of an issue. If you do have tingling going into the surgery, or you do get it after surgery, usually it goes away with time, but the occasional person might need revision surgery to address that nerve issue, and then potentially to remove some of those plates. The plates can be annoying. Most people don't need them removed. Most people, it doesn't bother them. But you can feel, especially the one on the inside, and you can feel the one on the outside if you try hard. And if it's rubbing on a tendon 6 to 12 months later, they might talk about removing those plates. So distal humerus fractures can be tough. If it involves your joint surface, sometimes it's shattered in a lot of pieces. And sometimes they're not even fixable. So if they're in a lot of pieces and you're 50 plus or 65 plus, then sometimes a surgeon will elect just to replace your elbow, not just fix it. Typically, however, we're going to try to fix the best we can and avoid a joint replacement, especially if you're 65 or younger. But it's not always something you're going to go back to normal. And sometimes it can be because the cartilage is broken so badly, you get arthritis, no matter how good we put it back together. So as far as if you're going to break something in your arm, the distal humerus intra-articular is not the best spot. However, most important is to find a hand-elbow surgeon with good experience. That's either a trauma surgeon or hand and elbow specialist typically, because these are tricky. These are not easy things to fix well, and especially if it's a pretty comminuted fracture. Overall, you can expect a long recovery, 6 to 12 months. And as I said, you're probably going to lose some motion and lose a little strength as well. As far as healing time, fracture typically heals at about 8 to 10 weeks, but can take a little longer, and sometimes can take 6 to 9 months. So probably the most important thing is to get in with a good surgeon as quick as possible, and then get ready to get that elbow moving. And when it's time to go to get that elbow moving, you are going to have to push through pain, and you're going to have to be aggressive with it. So have a good discussion with your surgeon about how to do that, and when he gives you the green light, you really need to go for it. Okay? Thank you very much.